I'm not under indictment anymore, and I'm been released, and I'm a free man. Late spring, early summer of 21 comes around, and they start talking about like college kids needing a vaccine to go to school. There's no way that we are going to get a vaccine, if it's even a vaccine, in 9 months when we've been trying to get something for AIDS over 40 years, and we're trying to get a vaccine for cancer for 100 years. And we're going to get something, for the common cold virus that's probably been around longer than humanity has, to work in 9 months with a novel technology that killed all the animals in all of the 5 studies that I knew about. And just, all kinds of things just didn't make any sense to me.
The so-called intellectual, what do we call them? The cognitive disciplines fell right in line. I mean, just fell right in line. And I thought, wow, it's right. The surgeons aren't as used to being sheep as we are, because we have been so beaten down for so long by, these clinical pathways and insurance companies. We're not allowed to make a decision on anything anymore. You guys, when you're in a surgical field, you're making the decisions. They can't intrude on that. And so you're able to still make decisions. And it was intriguing to me that you were the guys that kept speaking up.
The plastic surgeons that I know, most of them were, to some degree against it. I mean, obviously, we're not controlled by insurance, the cosmetic side of it. So we don't have people telling us, when to operate and when not to operate, and, what your capitation is, how many patients you have to see, any number of those things. We're not employed. But even then, Drew, it was amazing to me the number of people that still fell in line, still kind of bought the, bought the narrative. It just didn't make any sense to me. When you really sit back and you look at the narrative and you listen to it, and you're kind of sitting here, that the whole thing was based on fear and fear alone. Wearing a mask to prevent a virus is kind of like putting up a chain link fence to keep the mosquitoes out of your yard. Really doesn't make any sense to me how you can throw things out the window as far as just common sense, medicine that we grew up being taught. And, kind of like taking care of the patient first and dealing with the ethics and dealing with the morals, and not letting, your decision be decided by, somebody else out of the room, or some insurance company or some administrator or something somewhere else.
I don't know if you were trained during the AIDS pandemic, but I was deep in that thing. And that, that's an illness that had not a 1% fatality rate, a 100% fatality rate at the time. And we didn't wear masks. We didn't even glove up when we were dealing with the patients. It was like, what if we were so, oh my God, AIDS patient, so scary. When they had TB and they had pneumocystis, and they had all kinds of stuff, and they had coccidio. And guess what? We marched on in to do our job. And we never gave it a second thought, with a 100% fatality rate. And here's one with a 1% fatality rate, and people are cowering in the corner. It was the most bizarre thing if you went through that pandemic.
We, as physicians and scientists, the goal of a vaccine, and the goal of anything, especially vaccines, is to mimic natural immunity, correct? I mean, we are trying to give somebody a portion of a disease that way it prevents them from getting it, doesn't give. But natural immunity is the gold standard, right? So
of course,
these people here that had already gotten infected in 2020 are sitting here standing on the bandwagon going, look, I just got 2 shots. Why do you need 2 shots? And why are you pushing it on other people?